Hi, this is Dr. Bhargava, and this short video is about Centiloid Score on amyloid PET scans. So Centiloid Score is a biomarker for monitoring response to anti-amyloid therapy. It standardizes amyloid PET quantitation across tracers, scanners, and institutions, and it allows consistent interpretation and comparison. A 0 score is consistent with average amyloid burden in young amyloid negative controls. A Centiloid score of 100 is the mean value in patients with Alzheimer's disease imaged with C11 Pittsburgh compound B. So values less than 0 and more than 100 are possible. Cerebellum is used as a reference. Correct ROI placement is important. I will show you an example later. And you can use a software such as MIM or some other software to calculate the Centiloid score on amyloid PET scans. So this is how we report it. Typically, a score less than 15 is considered low plaque burden or reported as low plaque burden, 25 to 49 as mild, 50 to 99 as high, and more than 100 is considered very high amyloid plaque burden. We now have two treatments, monoclonal antibodies that remove amyloid plaque from the brain. These were approved in 2023 and 2024. These are given as bi-monthly or monthly injections. And amyloid PET is performed for initial evaluation and 12 months follow-up after these treatments. Amyloid-related imaging abnormalities, also called ARIA, can be seen in these patients, which represent edema or hemorrhage. And for those, or to pick up those findings, we perform an MRI of the brain with and without contrast. Also on the horizon, we have tau imaging, where we have a tracer, fluor tau CPIR, and there is a scoring system coming out for it. It may be called a Centaur system or a Centaur score. And we also have a treatment which is posdinemab that is coming up for treating tau plaques in patients who have Alzheimer's disease. This is an example of before and after treatment. The image on the left is before, showing positive study with high plaque burden, and follow-up treatment shows significant clearing of the burden, and the Centiloid score decreased from 140 to around 35 post-treatment. Here is another example where on the top we have axial images showing high plaque burden, and at the bottom we have images showing improvement in amyloid plaque burden post-treatment on amyloid PET scans. And here is the significance of drawing the region of interest correctly. We are looking at images of one patient. They were initially evaluated by the software, the images on the left, where the blue line and the pink line, in between those lines, we want the cortex to be, but it didn't register correctly. So there are tools where you can enlarge the image, move the image between these two lines to register it correctly, which is shown right here on the right, where the blue line now outlines the cortex and the pink line outlines the white matter. And so this is the correct ROI, and on the left is the incorrect ROI. So we have to be careful that the ROIs are placed correctly before processing these studies for Centiloid scores. Thank you for watching. Check out my books on Apple Bookstore and 2 courses on my website.